Hello and welcome to today's session, Conversations with GIA, COVID-19 and Older People. What are the essential policy roles for philanthropy? Before we get started, I'd like to go over a few items so you know how to participate in today's event. When you joined today's webinar, you selected to join either by phone call or computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in your control panel. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of your control panel. You may send in your questions at any time, and we will collect these and address them during the Q&A session at the end of today's presentation. I would now like to introduce John Feather, CEO of Grantmakers in Aging and moderator for today's webinar. John?
Thank you, Cody, and welcome and thank you. There are over 400 of you on the call today, so thank you for joining us. We also want to thank the Johnny Hartford Foundation for their support of the entire webinar series and for today's webinar. The coronavirus pandemic is impacting all segments of our society in unprecedented ways, from sheltering in place to social distancing to panic shopping. While much remains unknown about the disease and its course, we know for certain that older people will be impacted the most. Today, we have assembled a panel to discuss the critical policy issues that must be addressed and what the role of philanthropy should be. Our panelists will focus on policy at the national, state, and local levels. Joining us today are Kevin Prindiville, the Executive Director of Justice for Aging, Gretchen Alkema, the Vice President, Policy and Communication at the SCAN Foundation, and Susan Althans, the Director of Philanthropy at the McGregor Foundation in Cleveland. We thank you all for joining us. As was mentioned earlier, you can enter your questions for the panelists at any time during the presentation in the question box on the right side of your screen. I will be collecting these and reading them to our panelists during the Q&A period. So Kevin, let's start with you. Tell us a little bit about the national perspective on this important issue.
Thank you so much, John. And if we could advance to the next slide, and one more. So thanks, everybody. I'm Kevin Prindiville. I'm the Executive Director of Justice and Aging. If you're not familiar with our work, we're a national nonprofit legal advocacy organization that uses the power of law to fight senior poverty. So every day we're using advocacy tools like legislative advocacy, administrative advocacy, policy advocacy, class action litigation, strategic communications, legal education, and all of it is to secure changes in policy that improve lives of older people, especially those that are living in or near poverty. And if you could go to the next slide, I want to start today by just taking a moment of gratitude. I want to express my thanks to John and Grantmakers in Aging for hosting this webinar, and to all of you for being on this webinar during what is clearly a difficult time. And I'd like us all to take just a minute to think especially about the incredible and dedicated workers, the healthcare workers, the direct care workers, aging service providers, grocery store clerks, delivery people, so many others that are quite literally, risking their lives right now to keep us all safe and healthy and fed. And for those of us that are becoming ill, especially those workers that are in hospitals right now, providing that care in really challenging circumstances. So, in my mind, it's very inspiring to see the response of our communities during this challenging time. And on the next, if you could go to the next slide. This gratitude is especially owed by those of us that are working in the aging space because of the particular reality that COVID-19 impacts, all of us, no matter our age, no matter where we live, but it particularly impacts older adults. In this moment of crisis, older adults' lives are literally at stake. On the next slide, like I said, it's important that as we talk about COVID-19, we're really clear that all of us are impacted. And I think Gretchen later has some wonderful slides that show, they're not wonderful, the information is not wonderful, but they do a good job of demonstrating how this virus really is hitting many age groups. But for older people, the severity is really stark. So to date, about 8 in 10 of deaths due to COVID-19 are among people 65 and over. And this number has been changing some, but roughly we think about that for people 80 and over, the mortality rate for those that contract the virus is about 20%. So really quite shocking statistics. And it's critical to note that, at Justice and Aging, we really focus our work on the needs of low-income older adults, and particularly those that are from communities that are most likely to experience poverty as they age. That includes women, people of color, LGBTQ individuals, immigrants, people with disabilities. These are all people that are at increased risk of aging into poverty. And in a crisis like this, those existing inequities in economic security, access to services, health outcomes, really become very stark. And we worry that it's these communities that are likely to be hit hardest by this crisis as it continues. So the next slide. These numbers make really clear the strong need for advocacy now to ensure the health, safety, and well-being of older people in our communities. The reaction to the crisis to date, I think, really has revealed both the best and the worst of the way that our policymakers and our country generally treat aging and talk about older people. On the positive side, we've seen this remarkable response from healthcare providers, direct care workers, the others that I talked about at the start of my presentation. We've seen social distancing decisions made at state and local levels where leaders have stepped up and really made courageous decisions, including extra precautions to keep older people safe. And we've seen much of the public embrace these calls for social distancing and other measures, very much framed as in part to protect the older people in our families and communities. We've also seen calls for people to check in on and bring groceries to older neighbors, and people volunteering to help and really be there for the older people in our lives. We've seen the grocery stores, create special hours for older shoppers. So a lot of really positive things. We've also seen some of the negative elements of ageism that those of us that work in the aging space are often talking about and aware of. We've seen the media reports, especially early on, that sort of framed this as an issue that, quote unquote, only impacts older people. And so others didn't need to worry. We've seen calls more recently for, older people to consider, sacrificing their own health for the sake of our economy. And in some places, we've seen a slow response to the heightened risk of the virus that faces older people and all of us. So, in this moment, I think it's really an opportunity for us in the aging community to respond with a strong voice about the value and importance of older people in our lives, our families, our communities. We often talk about this need to be strong about the wonderful value that older people provide, and to reject ageist ways of framing issues in our society. And so this, I think, is a clear opportunity for our voice and our action. Next slide. So one way to direct that action is through, I'm sorry, I just lost track of something. So one way to direct that action is in furtherance of policies and programs that older adults need right now to help them in this crisis. And there's lots of different types of advocacy and policy work that we can all be engaged in. The first is policy advocacy at the legislative level, at the administrative level, working with our governments to ensure that the right rules and policies and practices are in place for this moment. Another way to do this kind of policy work and advocacy work is through education of local providers to ensure that those that are working in the field understand what's changing and how they best can serve and assist people in their communities. We did a webinar this week through the National Center for Law and Elder Rights that we run. It was a COVID-19 related webinar. It had over 3,000 attendees. So there's definitely a desire and a need out in the community to understand what's changing in the policy context and what that means for lives of people on the ground. I think another area where policy and advocacy come together in this moment is around the need to develop new and modify existing programs. So much changing, we need to be active in meeting need and changing and developing new programs. And then finally, in communications, how do we educate older people about what's happening right now? And then how do we talk about their needs in ways that really elevate the conversation among policy makers and in public, and how do, as an aging community, how do we help provide that leadership in working through communicating about this crisis. On the next slide, I'm going to drill down a little bit now in particularly the policy arena. And I think it's important just to be really clear that the policy levers at a moment like this are really at every layer of government, at the federal level, at the state level, at the local level. There's critical decisions that governments are making. And if we make the right decisions, it can really have a tremendous impact in saving lives and in ensuring the economic security and health and safety of older adults and our entire communities. So it's really critical that aging advocates across the country are engaging at these different levels. And engagement, we think of primarily as with governments when you're talking about policy, but there's also really opportunities to engage with private actors as well, with companies, with others that are putting together systems that can be responsive in this moment. I think aging advocates can provide particular expertise about what older adults most need in this critical time. Next slide. So there is no shortage of policy issues that are at play in this crisis. This slide lists all the areas where we at Justice and Aging have put forward policy recommendations at the state and or federal level. So they cover the whole array of public health issues and public benefits issues and healthcare systems issues and nursing homes and civil rights and elder abuse and scams and housing, a whole array. We don't have time today to go in depth on all of these issues, but I'll just say, that the way we've been approaching our policy work in this moment is at a broad level. A crisis like this, the policy response really begins as a public health response. We think it's important that for the aging community to be part of the call, to listen to experts, practice social distancing, flatten the curve, slow the spread, because this is going to save lives of the older people in our communities. Now, we recognize that the social distancing measures have profound and negative social and economic impacts on older adults and working families and children, all of us. So that's why we've also called for state, federal, local governments to provide economic protections and relief for individuals impacted by these measures. Relief, that we've been advocating for and been successful at various levels includes at a minimum expansion of the safety net, sick and family medical leave, emergency unemployment insurance, eviction protections, increased food assistance, more investment in Medicare, Medicaid, our healthcare systems to ensure that there's needed access to testing and treatment. And then also a recognition that all this social distancing also has an impact on the social isolation among older adults and other people. And so really we need this all hands on deck, all issue area approach to thinking about policy in this moment. I think in addition to that, we've seen some of these policies advance already. Just before our webinar started, we saw the CARES Act pass. This was the third legislative package to come out of the Congress. And that starts to address many of these policy issues. There was two packages before that addressed some of these policy issues, and gaps remain. There's still going to be more policy that needs to be developed as we continue through this crisis. And we're already working with partners in DC, for example, to start to identify the areas where we're going to need more action at the federal level to continue to make sure that we're taking care of everyone. I want to go. I want to say too that these policy issues are really connected to real life challenges right now. Some examples of questions that we've gotten just in the last week include, will my testing and treatment for COVID-19 be covered by Medicare? Will I owe deductibles and copays? Under what circumstances can I visit my mother in her nursing home? How does someone on SSI who has not filed a tax return get relief checks that are included in this CARES Act, this third legislative package that passed today? Will people have more time to make Medicare enrollment changes because of this crisis? Will I be able to see providers that aren't part of my Medicare Advantage network? Do the new paid leave law do the new paid leave laws cover older adults who are missing work because they're sheltering in place to limit their risk of contracting the virus? Do the paid leave laws cover someone who's caring for an older person because the normal caregiver is sick or is at home with a school-aged child who's out of school? You know, I could go on and on about the questions we're getting that really connect to these real-life experiences people are having in the day-to-day, and then these bigger policy issues that governments are working to solve in real time. On the next slide, you know, I think it's important to call out also just some special considerations, things that we're thinking about in populations that might otherwise be missed in some of these conversations. I think first is just the issue of equity. As I talked about at the beginning, different populations experience the aging process very differently, and their experience with the COVID-19 crisis is going to be quite different. So I think here, especially thinking about immigrant populations, especially the Asian American older adults, who are also dealing with some of the xenophobic and racist attacks, and that's really limiting oftentimes their willingness to be out, to be seeking services and supports. So I think that's an area of critical need. LGBTQ older adults also are going to have special needs and considerations in this time. We're thinking a lot about homeless older adults and what kind of supports they need to ensure economic security and health and safety for them in this time. Older adults who are living in prisons and what we can do to reduce their risk. And then lots of complicated and difficult issues around death and dying. People have been coming to us with questions about how do we approach things like advanced care planning and how care is provided at the end of life for people for whom the COVID-19 illness leads to that stage. And then also, I didn't have here, but I should have had here, social isolation. We've known that this is such a significant issue in the aging community to date, and now is going to become more attenuated. So next slide. A couple quick thoughts on roles for funders. You know, we've been really heartened to hear from many of our the people that we get grants from, of their support, of their willingness to do things like provide flexibility to grantees in this moment, asking what we need, asking what the community needs are, relaxing reporting and application deadlines and requirements. All that's wonderful. I also want to, make a call today of, philanthropy is really a powerful and influential force in our country, and aging funders have the opportunity to use that power in this moment to be a voice for needs of older adults. So I really encourage you all to be listening to your community, to be engaging with grantees and the older adults that they serve, identifying needs and using your unique role, your power to call for action that can help the community to really frame the value that older adults provide in our communities and the necessity of a strong response to assist them at this time. And then, of course, also, funding that can be provided. I've been really inspired by funders that have been releasing special funds to be responsive in this moment, to really step into the need. And I encourage funders that are doing that to also think about how they can empower grantees to be part of this policy environment. What rules need to be changed, and how can your grantees be part of helping make those changes so that needs can be met in this time? I think the leadership that philanthropy can provide right now is really a critical match to what's happening at the government level and in private corporations, and can really empower the networks of grantees that you have relationships with, and again, really elevate the aging space. So next slide. And then a final thing that you can do is just stay informed. So there's links here to our website. You can sign up for our network, and through which you get regular alerts. We're doing at least a weekly alert on COVID-19 policy developments, and we're about to be rolling out a series of webinars and written materials to help people understand what rules are changing and how that impacts the people that they serve. And then on the next slide, I also included here just my contact information. You can always reach out to me directly. And I just, in this moment, I really call on all of us to use all the tools that we have available to us to advocate for the needs of older people, And I thank you for having me. I look forward to my fellow presenters, and I'm going to pass it on now to Gretchen Alkema from the SCAN Foundation.
Great. Thank you so much, Kevin. I appreciate that, and a really great lead in for the conversation today. Thank you all for being here with us. Thank you to Grantmakers and Aging, John and the team who brought this webinar to come to life, along with support from the John A. Hartford Foundation. And I'm really pleased to be here with Kevin and Susan to bring this topic forward. For those of you who are unfamiliar with the SCAN Foundation, we're a nonprofit public charity in Long Beach, California that works on issues both in the state of California as well as nationally to transform care for older people so they can live well in the place that they call home. And so let's move to the next slide. Kevin gave a really great kind of conversation about what I would call the who and the what at this point, you know, that giving a lens about the populations who are being affected by COVID-19. You can see the tracker map from Johns Hopkins University. In case you're unfamiliar with this website, it gives that drill down by area. Now it's giving drill down by state and localities inside of the US. So you can kind of get a sense of where things are moving and heating up and simmering down in some spots right now. And the what about the policy issues and in the big buckets. And my job really here is to talk about what I would call the when and the how. What are some ways in which the SCAN Foundation in particular are addressing these issues with a focus on what we're doing in California and the kind of the time sensitivity around the response, because I think we've got a couple different time windows going, so I'll speak to that a bit. And then I'm really pleased that Susan is going to give kind of a bird's eye view of the local level in her area. That really brings in specific examples of the who and the what and the when and the how, kind of pulling it all together. So, but I did want to start with just what the map looks like as of yesterday. Pretty astounding. And I was just looking at the tracker right now. That as of 10 minutes ago, there were 96,686 cases in the US with 1,468 deaths. We obviously are monitoring that to see where that's going to grow and the ways it's going to grow, and you know the terrible impact of this virus at this time. We're going to see a lot more action, I think, over the next 2 weeks continuously, and it just takes my breath away, frankly. So let's go to the next slide. And this was a little bit deeper dive on some of the numbers that Kevin gave in his presentation. This graph is from a publication that the CDC puts out called Morbidity and Mortality Weekly Report. There are more things coming out almost every day right now from this publication, and that you can get it online. But this graph, I think, really tells the story for me, that the light blue bar on the far left in each cluster is the kind of amount of hospitalizations that we're seeing, in particularly by age groups. The middle bar, ICU admissions. So lots of people go to the hospital, and then you're seeing kind of within the age groups who ends up in the ICU. This is particularly important because it was about the early phase of the first month of when COVID-19 really hit the US from February 12th to March 16th. So it kind of speaks to what was happening in a healthcare delivery system that wasn't overrun yet, the way that we're seeing it in several areas in the US right now. And then what we're seeing in terms of death rates across these various age groups. And you know, the most stunning is getting to the far right hand of the graph, where hospitalizations, the ratio between hospitalizations and death is pretty profound, particularly in the 85 plus group. So I suspect we'll see continuous updates of this kind of charting and other cuts as we go forward on the data as we know it. So moving forward on to the next slide. I'm going to break down my comments into two time frame buckets through the remainder of 2020. And I think it's really particularly important because there's things to do now. And I truly mean like now, today, through June, through this really first big hump of the virus's expression in the population and how it relates to those three buckets: the hospitalizations, the ICU, and the mortality elements across all of definitely across the globe, for those of you who may be thinking about this from a global perspective, but most particularly as we're talking about the US today. And this is what I think of as really crisis response at this point. The things that we are working on at the SCAN Foundation is talking and advising state leaders about how do they think about crisis communication for these populations of older adults, those with complex care needs, frankly, across the age span, as well as family caregivers who are experiencing, an unprecedented working at home rates, kids at home out of school, still caring for older parents or more deeply concerned about older parents who may or may not be at the highest levels of risk, may or may not be within driving distance. It's really unprecedented. And so having communications that really speak to the needs and the heart of people who are experiencing the traumatic shift in their life in this point in time, we see as really critical. So we're working with some folks in state government on that, as well as collaborating and working with aging and disability advocacy groups on the ground to continuously create message clarity about what is it that people do. So much talk just about what does social distancing mean, and how to not confuse social distancing with social isolation, trying to move the conversation more towards physical distancing. That level of message clarity and at that very personal level, let alone what is the message clarity about when can I go to the grocery store? If I do go to the grocery store, how do I do that in a way that doesn't put me or my loved ones at greater risk? All of those pieces that really are well said and well received by local advocates who already are the trusted voices and advisors to folks in their community. So we're delighted that we have worked for many years with these groups on the ground in California who are doing a tremendous job of getting clear messages and the voice of the public health voice out into the communities that they serve. This is also a place where those groups can identify what the local issues are at all of those buckets that Kevin expressed, and how to bring them up to the right level of authority to get some resolution. And Susan's going to talk about some elements on that aspect. And both, there's the idea about finding out what are the problems, but really being creative about what are the solutions, especially when the solutions are tough right now. Excuse me, particularly in things like transitions of care. If someone was in a nursing facility and they ended up going into the hospital, where do they return to if the nursing facility doesn't take them back because they're still testing positive? Really, really fundamental self and wellness and health issues for all involved. We are supporting the state legislative bodies and champions by briefing them, by problem solving with them, helping them get this on their radar, which then allows them to partner effectively with aging and disability advocacy groups on the ground. We believe strongly that using social media channels regularly right now is the right thing to do, both in terms of putting forth clear information from the trusted resources, both at the federal level and in the state, like pushing out the CDC messages, pushing out the WHO messages, as well as continuing to bring forth, where are things going well? When the grocery stores in Southern California, particularly Northgate Market, which serves, primarily a Latino community across the Southland, was the first to put forward, special store hours for older people and pregnant women, how important it was to get that message out, to praise them, champion them, and really get other grocery stores on board. And that came to pass. It's just a really small example about how your social media channels can advocate for good solutions. This last bullet is tough, and we're still thinking through what our solve is right now, but it's really important to utilize the hook of Older Americans Month in May. The question is how at this point. Older Americans Month goes through the entire month of May. So I think we'll be watching what happens over the next 2 to 3 weeks to craft what the message is. to put that out through social media channels, through all of these other elements that I've spoken with, and using our boss, Dr. Bruce Chernoff, as a continued voice on these issues. He can speak about it from the philanthropy side and as well as speak about it from the physician side. So we're grateful with that. And I would really encourage you to find people in your community, if you don't have them already, who can speak to this issue from every single angle that connects with an audience that needs to be both heralded as champions, that gratitude list that Kevin put out, how they can say thank you, thank you, thank you, and here's where we need to go as a community to keep people safe. Let's move to what I would say is kind of the next tranche of time on the next slide, moving beyond immediate crisis response to really thinking about what is the next phase activities. The information that I'm receiving through many trusted sources is that this is ripe, a virus that's ripe for multiple rounds of an outbreak. That we will have a second outbreak is very likely. We may have a third outbreak. That there's maybe a continuous cycle. So part of what we will be doing in July, and particularly in the summer months where we expect that the virus's activity to be slowing down, is that that's our time to ramp up an evaluation of what were the messages that worked, what was the policy response that worked, what were the things that didn't work, and how do we retool that to get ready for the fall? And then how do we do that again and again and again, with the idea that we're not going to just have one round of this rodeo. That also includes monitoring what have been the federal and state regulatory changes, particularly through the Center for Medicare and Medicaid Services. That's what this hot link is. When you get a chance to see if you can click on it now on the slides or later, it will take you to the CMS emergency response page that speaks to all of the regulatory changes that have occurred in the last, I'm going to say, 60 days is probably a comfortable window to look at in terms of what are things like access to telemedicine, things like repealing the 3-day hospital stay in order for people to be able to move into a nursing facility. I mean, so many different regulatory changes at the federal level, also at the state level, and then the intersection of the two. And that's an opportunity to also look at what's worked, what hasn't, what's appropriate for emergency time, but needs to return to where it was, what's appropriate to say, let's move forward on some of these things. And we just won't know until we take a really good look of that over time. This is also, I think, a critical period to rethink kind of what are your existing strategies and forthcoming projects through the lens of COVID-19. And that can be on any area that you fund on. You can email me what your area is if you're struggling to think about what's the aging and the COVID lens. And I'm happy to have my own conversation with you about possibility what that means, because I think every issue area that we work on in social policy, which touches all of us and all generations, has both an aging lens, but also has an intersecting COVID-19 lens, because this is truly affecting all of us in so many different ways. So this is an opportunity to take that strategic moment over the summer and kind of retool what might you think about in terms of the response, even if you're not a direct healthcare funder or play directly in the healthcare space because of the public health angle. And then, getting to that place of November is National Family Caregiver Month, and thinking about what will your messaging be at that point in time, because family caregivers still are on the absolute front lines of this within their families, both on the preparation side as well as on the support side for an individual who is ill and working through the recovery process, or frankly, in the process of dealing with the grief of loss of loved ones through this really terrible virus. So let's move on to the next slide. And on the website for the SCAN Foundation, we have our thoughts on COVID-19, directing people to, again, those really clear and trusted resources in 3 big areas. I realize that this slide does not have social or physical distancing in it. I've already received that comment, but I think the spirit of that we can feel connected in our hearts and minds, even if we're going to be physically distanced. And so we think it's really important that people know that they're not alone. and take action to grow a circle of support in this really difficult time. It's so exciting to see people using Zoom to connect with neighbors and loved ones, and social circles. I mean, just things of that nature. Beyond FaceTime, to find that circle of support in really challenging moments. And then also that thing that I think is hard for all of us to do, which is showing strength by asking for help. And that's what I think that we're seeking to do in the broader philanthropy community as well, and connecting with all of you here on this webinar so that we can connect with each of you about how this stone soup exercise that we're having right now in America and the globe, we all bring something really unique and valuable to the table. So let's move to the last slide. You can see where to find us at the SCAN Foundation and connect with all of our social channels. I'm just really, I'm really have heightened pleasure in the middle of this terrible crisis to see so many people coming together and putting older adults and those with complex care needs and family caregivers front and center in the battle. So I'll turn it over to Susan.
Thank you, Gretchen. So first, as Vice Chair of the Grantmakers and Aging Board, I'd like to thank you for joining us. I think this webinar is certainly an example of GIA's value across so many different spaces. So just wanted to kick off with that and thank John and the GIA team for all the hard work that they do. So McGregor is, is a comprehensive provider of a comprehensive provider for vulnerable seniors. And as a provider as well as a funder, we strive to meet our mission of supporting seniors in need and those who serve them. And certainly today we find ourselves in a very unique place, being on both ends of this, both delivery of care and then as well as a funder. Next slide. So if I can put this sort of in a community context, if you will, Cuyahoga County, which is Cleveland and surrounding inner ring and outer ring suburbs, is now addressing what we call the new majority. By 2030, there will be more individuals over age 65 than there will be under the age of 20. And Cleveland has the second highest concentration of baby boomers in the country. And third, I'll add this in terms of a community context. In Ohio, our governor, Governor Mike DeWine, was one of the earliest and truly one of the most aggressive governors in addressing the pandemic. And I think if you follow state by state rollout of what's happening, you'll see what Ohio looks like compared to other states that were much slower in mandates and all of the CDC recommendations. And Ohio, although we have a long way to go, I think there are many, many of us in Ohio who are grateful to Governor DeWine and his team for what they instituted early on. So what does this mean today? Next slide. So McGregor is really, as I said, a unique study in that we're located on 4 campuses and we have a fairly complicated set of business lines. We offer residential housing, which includes independent living, assisted living, HUD 202 units, skilled nursing, long-term care, and hospice. That's one pillar. Our second pillar is we are the only PACE provider in Ohio, and that's delivered through 3 different campuses. And third, thanks to a significant endowment, we have a grant-making operation. And all of this ties to essentially a $65 million operating budget across those 3 stool legs. So as you see, we're a direct service provider and a funder, and a lot at stake. But also at the end of the day, we can't send our seniors home. We are home for them. And there's certainly social distancing, but we are living this 24/7 on all of our campuses. Next slide, sorry. So we have about 600 staff members. So what does all of this mean to them as employees of McGregor as well as their personal lives? And also for our grantees, we make grants of about $1 million back into the community for direct service as well as supporting convening and advocacy activity. Next. So we certainly have challenges, but we believe that we also have timely responses as well. Next, please. So here we are, March 2020, COVID is here. We're seeing it in PACE in terms of the importance of continuity of care to PACE participants, allowing those seniors who are dual eligible to remain in their homes, but with access to services. Now, our governor has closed down congregate senior centers, and so we still have our PACE services, and we've maintained our home health, which is critical for the 600 seniors that we serve in their homes. But certainly this is going to place undue pressure on urgent care and hospital settings who are already under the strain due to COVID, which is certainly right up front in the headlines all over the country. Next. So from the residential care end of things, there are huge stressors related to this. If you think of our staffing here 24/7, what we need to do to meet mandatory staffing ratios. How do we pay our McGregor employees a living wage so that they come to work and that they provide the care so desperately needed for these vulnerable seniors? And we've instituted a number of policies and positions in the past which are really paying off. For instance, we have a manager of employee success who right now is working tirelessly to sort through policies and mandates to identify means by which to help staff so that they can come to work, so that they aren't faced with challenges related to child care, food insecurity, transportation. So the policies for us are real, not just in terms of what affects senior citizens or older adults, but the workforce that delivers the services that are so desperately needed. Now, we're looking at in real time what happens if staff calls off or we don't have sufficient PPE. Those are real-time concerns for us. And so it requires time and effort and money by McGregor to assure our continuity of care for all of our seniors here. Next. In terms of grant making, as I mentioned, we're unusual in that although we're a 501c3, we have a significant grant making budget, and we've adopted what we term a hub and spoke model for funding priorities of affordable housing with services, issues related to workforce, quality of life, and community projects. So what now? We have the challenge of funding internal operations here at McGregor through our two stool pillars, both the PACE and the residential care. So we have to cover payroll, we have to maintain frontline provider services, but then we also have to make sure that our community partners are securing the operating dollars that they need. For instance, our Greater Cleveland Food Bank here, which is doing absolutely incredible work, helps us in that we partner with them and have a food pantry on our own campus. So of course we want to see policies related to food security for the Greater Cleveland, for Cuyahoga County, for Ohio, but we're feeling that right here on our own campus. Additionally, any other policies that relate to legal aid, our employees from time to time, of course, look to legal aid for assistance, and then other grantees such as our Transportation Connection, which allows seniors to, in a time like this, even more importantly, access medical care and grocery and pharmaceutical runs. So all of these are important partners to us, and we consider them when we look for solutions and policy considerations. Next. So what I would say to all of you is that policy needs to be informed by providers like McGregor. The real need today to think, as Gretchen said, what are we doing short term, what are we doing medium term, and then long term. Certainly, we're all very familiar with the first three, the PPE, increased testing, and then issues related to workforce. We here at McGregor are working with a local organization, but it's local, but it's statewide in its efforts, and that's the Center for Community Solutions Council on Older Persons, as they educate legislators and are in constant contact with the Ohio Department of Health and Ohio Department on Aging, as well as the Ohio Department of Medicaid. On a day-to-day basis, we also look to our industry leaders because they have a collective and very, very powerful voice within the state and nationally. And so the CDC, Leading Age Ohio, and then the National PACE Association. And we look to them to promote policy and then really to communicate effectively for collective action. Next. That's it. If you're interested in learning more about McGregor, please feel free to take a look at our website. And again, we thank you for joining us today. John?
Thank you, Susan, and thank to all of our speakers for the really excellent presentations that cover such a wide array of issues, but also shows that there's work to be done both today and in the future. And this, whatever the course of this specific disease may be, there are a lot of issues that we need to be addressing for older people. We have some time for questions. Please continue to go ahead and write those into the question box that you see on your screen. And to start out, we have a bunch of questions about about whether or not the slides will be available, and the answer is yes. Both the slides and the audio will be available. You will get a direct link from us telling you when those are done. By all means, please share this with anyone who might be interested. This is not restricted content at this point, so we would love to have you help us disseminate that. So that'll be coming to you very shortly. We also had a request from several of you that when Kevin was going through his really interesting list of the questions that you have been asked in the last week, I was trying to scribble them down too, and I think a lot of people were. And are those available any place on your website?
The questions are not available on our website. We're working on answers to as many of the questions as we can find, but I can I have those questions written down, and I could share them with you, and we could make them available with the rest of the materials if you'd like.
All right, that'll be great. So Kevin will get it to us, and we will send it out with the email that all of you will be receiving. So thank you for that. Kevin, let's stay with you for a moment, but I think everybody else will have some discussion about this. A number of questions about issues specific to homeless populations. And what kind of policy issues you're working on there. So could you talk a little bit more specifically about the homeless population and COVID-19?
Yeah, sure. And I'd say there we're following the lead of those that really focus on homelessness, but trying to make sure that the strategies that they're developing are also inclusive of older adults. So I think significant strategies around from the homelessness and housing advocates have been around local protections against evictions. So we've seen a number of jurisdictions across the country adopt moratorium on evictions so that we keep people from becoming homeless because they're not able to pay rent because of changes in their work status and economic status right now, all related to everything that's happening. For people that are already homeless, looking for ideas and strategies to help people get into safe environments. We know that the spread of a virus will be, could be particularly catastrophic and for people that are living in unsheltered environments, living on the street or living in encampments. So, how can we work to get people into safe housing very, very quickly? And then taking into account the particular needs of older people in those situations. So how do we account for their increased health risk? Generally, older people that are living, that are homeless, already face like severe healthcare challenges. So now that risk is even greater. So I think, primarily if we can get people housed quickly and safely where they can be physically, isolated while hopefully still maintaining social connections, that will be much safer than having them continuing to be living outside and at risk of significant spread.
Gretchen or Susan, anything to add on that one?
Sure. I think this creates an opportunity to re-message right this moment in terms of kind of what has been kind of a pure message of homelessness to shifting it to a public health message in terms of increasing access to shelter in community environments where maybe the homelessness services message hasn't had as much traction as we would like. And so that's what I'm seeing. Again, homelessness not being an expert in that arena, but as I'm watching the dialogue, reframing the conversation to mitigating increased public health risk seems to be the play that many mayors and many boards of supervisors are taking in terms of maximizing shelter and being really creative in terms of the ways that shelter and the resources to fund that shelter in this moment in time. It's just kind of coming together. So the communications really matters in this realm on every angle.
Susan, anything on this one?
I think that's well said.
Okay, that's great. Susan, let's come back to you. You made a compelling case, and a number of people are asking specific questions about how you join together with other local philanthropic and service providing groups. So could you tell a little bit more about whether there's activity in the region around pulling philanthropy together, and then how that's interacting with your service provider community?
Sure, and I'm hoping she's on the line as well. Kathy Hallisey from the Cleveland Foundation and her team have been very instrumental in forming a COVID-19 fund across the community. It really just popped up over the last week or so, and there is an element of groundswell support to that, for additions to that fund from corporations, from individuals, from foundations as well. And it's interesting, there are two sort of ways of looking at that. It's certainly a way for funders to convene related to the issue, which crosses across all ages, of course, not just aging. And then there are funders who are feeling that while that work is important, that they're able to actually provide more laser-focused funding for their specific interests. So I think they're all valuable ways of approaching the issue.
Right. I think we've got time for one more question before I return to our panelists for their final words. And that is an issue that Grant Workers and Aging has been very involved in, and that's providing for older adults in rural areas. In the discussions you're having at the local, state, or federal level, are you hearing much about thinking about the particular needs of those in rural areas? And I'll let anybody take that one.
Well, this is Kevin. I think that I'd say right now there's definitely more attention being paid to the urban areas because that's where some of the outbreaks happen to be for now. But from what the experts are telling us, there will be spread into these other areas, and so some of the issues we're seeing in the urban areas we know will just be that much worse in the rural areas. So I think of hospital access and the concept of hospitals being overloaded, and then in many of these rural areas, especially the ones that have had a lot of closures of rural hospitals in the last 5 to 10 years. That's going to be a real severe need. Another one is in the provision of home and community-based services, where there's concerns about worker shortages, that when workers are sick or have someone else to care for and aren't able to come and provide that home-based care, there's a lot of policy work being done to create backup systems. But in the rural areas, that's going to be more difficult to replicate because of availability of providers. So yes, absolutely. This is a place where more work needs to be done and where we have some real concerns about how things may play out.
Well, at this point, I'm going to turn then. Go ahead. Sorry.
Oh,
Gretchen?
sure. I was just going to add kind of one last thing. one of the things that I learned working for a senator from a rural area is that hospitals are generally the largest employer in that area. And I think that's particularly important in terms of keeping the economic processes for all families in that area stable while continuing to provide the best access of care that exists. I'm particularly concerned about things like critical access hospitals that have closed over the last 5 years that Kevin has shared. And this is an opportunity for local level advocacy to folks in their state to open up those hospitals in order to be shelter in space for people who need to have containment. That's something that's happened with Community Hospital here in Long Beach that has been closed for a number of years through just hospital mergers. That hospital closed, and it just is in the process literally of being reopened in order to be a quarantine space for people with COVID-19 in the local area. And that was because of a lot of local level advocacy, but also state leaders who are looking for space to provide that kind of quarantine in an effective way. So that's available for folks who are in the rural areas to bring that space back to bear in this equation.
Well, thanks so much. I'm going to turn now to each of you for your final comments for our audience. And Kevin, let's start with you.
I just want to thank you all again for being on the webinar today, and to John and Great Makers and Aging and the Hartford Foundation for putting this together. And I just call on all of you to really use this moment to recognize the power that you have as aging advocates and providers and funders to step up to this great challenge facing us. So we can get through this if we pull together, but that's going to require really a strong and active response from the aging community. So thank you.
Gretchen?
Again, thank you. And I think the thought that I would have for all of the folks on this call is a recognition that we're in a deep series of marathons, that it feels like a sprint right now. However, this virus will likely be with us for a while and will return again in a different kind of force. And so thinking about that in terms of your overall strategies and tactics and policy and communications work, programmatic funding, but also in terms of taking care of yourselves. This is a great point to remember. None of us are flying these days, or very few of us are flying these days, but it's a good reminder that we need to put our oxygen mask on first in order to best be of service to those around us. Thank you.
Thanks so much. Susan?
I'll be short. I would say look to partners so that you can amplify your voice. There's a lot of messaging that can be done, and it's stronger and it's more efficient and effective if you can join forces with others.
Well, thank you so much. I want to thank Kevin Prindiville, Gretchen Alkema, and Susan Althans for all the work that they do to provide help during this critical time, and the work that they do every day to make life better for our older population. I also want to thank the John A. Hartford Foundation for their continuing support of this webinar and the webinar series. As we said, we will be making today's presentation available to anyone who wishes to view it later, including the slides and audio. Watch for an email to be sent to you in the next few days, and then it will also be posted under the webinar part of our website. And finally, we want to thank all of you for participating today. Please stay safe, as Gretchen says, and have a great day.